Joining us, Republicans have some pretty tight margins in the Senate, tight margins in the House. Does it go through?
Rich, I was sitting here thinking about this today. In my career as an obstetrician, I feel like that this bill is 3 weeks past its due date. It's time to have the baby. Everyone's upset. That means we're probably close to where it needs to be. We cannot blow this chance. This is the president's legacy, his agenda. If you supported President Trump, you should support this bill. This is going to be the largest tax decrease in American history. We're going to secure the border, a whole lot of other good things. But mostly, this is the beginning of America's great golden era.
Now that you've got some discussions on a number of different issues, one of the issues has been this state and local tax deduction. A lot of Republicans who live closer to northeastern cities like New York, Congressman Mike Lawler just told Fox Digital that he is happy with the compromise you have on basically deducting from your taxes what you send to your state and local governments in these high tax jurisdictions. Do you think that that is a good indication that this bill is going to get the type of support from the more moderate Republicans it needs?
Well, over in the House, I think we have a little tighter margin. And again, I think that what we asked the president to do here was split the baby, but he's keeping the baby together. This is the best we can get. Speaker Johnson was there with us yesterday negotiating this to the last second. I think everyone has thrown their best argument on the table. I think that's a great step forward. I wish we were cutting more spending, including this, but this is the best bill that we can get through the finish line at this point.
You've written on Medicaid on this. You're a doctor. You wrote in Newsweek recently, Medicaid is the most broken program in our country. Having Medicaid does not mean you have access to health care. Only 74% of physicians accept Medicaid, and many of those who say they do never see patients on Medicaid. Others string out appointments and limit the number they will see. Democrats have been very critical of the Medicaid provisions in this bill. Here's what Senator Durbin had to say.
What they're trying to do to cut back on these health care programs and health insurance for 16 million Americans to pay for tax breaks for wealthy people is just not a winning combination by the parliamentarian or with the American people.
So won't cuts to Medicaid mean fewer services to those on Medicaid?
I don't think so. Again, just because you have Medicaid doesn't mean you have access to care. You pointed out a third of doctors don't accept Medicaid, another third basically rule them out through the schedule. What our bill does is give a block grant for rural hospitals, for community health centers. One of my 3 pillars of MAHA is making sure that everyone has meaningful, affordable access to primary care. Even Bernie Sanders agrees with me that these community health centers are a great way to do that. I think that health care will be better. And in this bill, we absolutely preserve Medicaid for those who need it the most. We don't touch seniors in nursing homes, people with disabilities, pregnant women, children. So we'll protect Medicaid for those who need it the most. And on the other hand, we want to make sure everyone has access to care. We'll do it through a block grant. I'm so proud of the work we've done here as far as making health care more affordable and more accessible.
Where do those savings come from?
So the savings come from a couple of things. One, something called a provider tax, which is absolutely a scam, a money laundering scam, where you have one state maybe getting 25 times more per person than what a state like Kansas is getting. So we need to level out those provider taxes. And then as we talk about people that may lose Medicaid, half of them are people that are on it fraudulently or through some type of an error. And the other half will be those ones that are refusing to work 20 hours a day. Again, 60-70% of Americans support some type of work requirements. If you don't have a disability, you're working age, you don't have a child under the age of 13, then I think it's reasonable to ask people to work or volunteer for 20 hours a week.
You've been pretty busy up there on Capitol Hill. You had a briefing on the Iran strikes. How close is Iran now, do you think, or from what you've heard, to perhaps restarting its nuclear program? How much have they been degraded?
Look, I think it will take them years just to restart their nuclear program. I think that they can't control their airspace. They don't have the will to do it. From what I've seen, I'm in shock and awe. It's shocking how much damage we did to their facilities. Obliterated is a great term. I'm in awe of our military, the great job that they did. Thanks to all those Air Force guys who did this off. I'm an Army guy, but I'm still going to salute them. They did a great job. And thanks to all of our soldiers over in the Middle East. I don't see Iran getting back in this ball game for several years.
Now, the president says if they do attempt to get back into the ball game, he would absolutely consider more strikes. Do you support that?
Absolutely. Iran cannot have any type of nuclear bomb. If they don't want to move things to a different direction right now, then we need to double down on our sanctions, whatever we need to do. Look, I don't want boots in the ground. I'm tired of all the killing. I want all the killing to stop in Gaza, in Iran, all these different places, Ukraine. But at the end of the game, Iran cannot have a nuclear warhead.
Senator Roger Marshall, thanks for joining us.
Thank you.